My name is Akhil Paul. I work for Sense International India, and we work for people who are deaf-blind. We decided to work for these children because children who have combination of vision and hearing problem, they don't get any schools. Till 1997, there was only one school in the country for deaf-blind children, and only 25 children were getting educated. We work all over India, look out for partners, schools for the blind, for the deaf, learning disabled. So we have about 38 partners all over the country. For a deaf-blind child, the world is limited only to his hands. And we have to open the world which is beyond his reach. That's what our teachers are doing right now, bringing the child out of their isolation. Meena is one of the newer finds for our program. When we found her, she was totally bedridden. And then the day she stood up and took first few steps, people started believing that there's something can be done with Meena.
Her mother is saying that she has learned so much. She can now eat food and she is just moving around the house independently. And it's a big change.
Our major intention is giving training so that they can look after themselves and people can accept them as individuals. They can lead a life of example so that people can understand that deaf-blind adults can be contributing members of the society. And that's where the STARS Award will help us reach faster. When we started in 1997, we started with kids. One of them is Rajesh. Now he has been trained to run his own sweet shop. He's supporting his parents, and there are many such young adults in the country.
This is Hansa. Hansa is deaf-blind and is now actively supporting the family in all the household chores. Hansa was identified by community-based rehabilitation workers locked in her house because the parents had to go out for work from morning till evening. It's really heartening to see Hansa, such a happy girl, dancing with young and old alike, like one of them. Child Welfare Scheme Nepal works in the field of health education and the social opportunities. From a health education point of view, we have a total 14 daycare health centers in the rural area and Asha Healthcare in urban area. The recent year, we served 26,000 beneficiaries with all our projects. Most of the people we work is the disadvantaged group. And the people who doesn't have money to go to the hospitals is a primary health care where they can get the free services.
So this malnutrition is the very serious, significant public health problem in this community. So after the treatment, he will be healthy and he can sustain his life.
Asha Clinic mainly works for the people from the slum area. And it's a primary health care and it's for the kids from age 0 to 16.
This is very happy getting the medical support from Asha.
Jyoti Street project is giving the service to the street children under the 14 years old. This center open for 24 hours. We are providing for them shelter and non-formal education, foods, and they can have a wash here, they can have a relax here. Jyoti Street project is running the Child Development Bank and they can deposit their money when they want to. The Star Foundation Awards open the door to be independent because we can expand our health program.
It's an unrestricted grant which gives you independency to spend the money where's the need of the beneficiaries. From this funding, certain part we can use in the administration. And administration is a kind of like a heart in the body. Without the administration, none of any organization can function.
CWS have a completely unique holistic approach by providing education for the young children who are 2 to 5 years old, and then non-formal education for the street children, and then provide the vocational training. We bring the big changes in their life.
Preeti Patkar. I'm associated with a volunteer organization called Prerana. We work with children of prostitutes. These children are a free recruit into the flesh trade. What we saw was that these children, some of them would be mildly drugged and put to sleep under the bed where the mother would be servicing her client. The night care centers that we've started are all based in the midst of the red light area where children come in the evening, they stay with us the entire night and go back to school or go back to their mothers the next morning. Besides the night care center, we have a lot of education support. Once the children are at our center, they go through a complete health checkup. We do have a lot of children who test positive for tuberculosis. Children are sometimes undernourished. At our center, they have breakfast, then they have dinner. They have actually 2 midday meals. We have a program called the Dancing Feet. This is to help children cope with their stress and anxiety. It also helps them to calm down to a great extent. There wasn't a single woman in the flesh trade whom we had met who did not desire change in the life of her child. I am with Chanda. Once upon a time, she was also a prostituted woman. Her child was enrolled in an institution. Today, she's very happy that her son is in class. We have a 24-hour shelter for girls. There are 22 girls there who are undergoing a training program in catering and hospitality. We won this award because we've tried to give a dignified life to these children. When you get unrestricted funds, you can always use it for innovative and creative ideas.
I want to be scientist.
I want to be captain. I want to be police. I want to be doctor.
These invisible children have a right to choose.